Ini parah nih.
As funny and as little as that fall is, it can change the trajectory of a person's life. This is called a fall astride injury. It happens when somebody falls with two legs separated, like parted between a hard object. This could be seen in bottom falls, in horse riders' injuries. It could be seen in falling into a ditch with one leg up and then the other leg down. And what happens here is that when this fall occurs, the urethra, tiny tube that carries urine from the bladder to the outside wall, can get injured. When this gets injured, your body tries to heal the injury, and on healing the injury, sometimes it forms scars, and these scars cause obstruction. It could be as bad as making the person unable to urinate, difficulty in urinating, pain on urination. Some of them, it gives them hematuria. And in an attempt to help this patient, a tube is passed, which is called a urethral catheter. Sometimes, if that tube is obstructed, like very obstructed, they'll have to open another tube on the pelvic area called a suprapubic catheter, and then the person is able to, pass urine. Sometimes, this supportive treatment can be for life. That's how bad it could be. That means the person would have to be on urethral catheter for life, except the person goes for a surgery which is called urethroplasty, which the success rate isn't very, very okay. So how then can we prevent this? We can prevent this by changing bottoms. I think we are now in an era that uses a normal bathroom setting. Bottoms have higher risks of injury and accidents while riding bicycle, horses, and what have you. Try as much as possible to be very careful. And then you see that ditch holes that we see. Try as much as possible to avoid them, no matter how strong you feel they are. Try as much as possible to jump it. When you see a gutter with some all this wood something they used to cross the gutter, if you can jump the gutter, that is better, because sometimes the wood isn't very strong to carry you, and then if the person falls, cannot give that fall astride injury. So try as much as possible to avoid things like that. So I'm Tochi. I talked to you about your health first and then about medical school. Stay healthy, guys. Bye.